Is lymphedema curable or irreversible?
Once the lymph system is damaged, it really doesn't repair itself very well. If you have lymph nodes taken out, they don't grow back. So we consider lymphedema to be irreversible because it generally can't be completely cured. We can always make things better though, so we can reverse some of the symptoms even if we can't completely get rid of the condition.
How can we improve lymphedema symptoms?
There's lots that we can do to improve the symptoms. So the lymphatic system can always be stimulated to work a little harder, so we can do lymphatic stimulating activities, and the right kind of exercises are something that can be done for lymphedema. We can also make sure that we turn down the tap, and so people with lymphedema will often need to wear compression garments, so we put a bit of pressure into the tissues. That stops the bathtub from filling up so much and helps the drain to clear better. There's quite a few different things that people can do at home to help their lymphedema as well, and really it is something that people need to manage themselves at home.
So what is the most common misconception about treating lymphedema?
Probably that it can't be treated, and this is an unfortunate perception that there's nothing that you can do for lymphedema. But actually there is a lot that we can do for lymphedema. We can definitely improve the symptoms of lymphedema. We can prevent lymphedema from progressing. It's a chronic condition. If you do nothing about it, it's going to get worse. So we can certainly do treatments that prevent lymphedema from getting worse. And the most important thing is that we can identify people who are at risk of lymphedema, and then we can give them treatments, and we can give them a home-based program to actually help prevent the lymphedema from forming in the first place.
Could you describe more about what is the treatment like, and is there any name of the treatments that we can get?
So there's different schools that teach slightly different methodologies for treatment of lymphedema. We're the Dr. Vodder school, and we have a very specific way of manually assisting the lymphatic system to work better. Other schools have a different system, which we don't believe stimulates the lymphatic system quite to the same extent. But there are 4 core therapies that we need to pay attention to for people who have lymphedema. One is the manual stimulation of the lymphatic system, and whether that's a qualified therapist performing manual lymph drainage for the patient, or whether it's self-lymphatic drainage. We teach our clients to do their own specialized lymphatic drainage at home. So that's a stimulation of the lymphatic system. Compression is a core therapy for most lymphedema, applying compression using compression garments. If lymphedema, when we first treat it, we actually use multi-layer compression bandaging to try and reduce the size of lymphedema, and then we use ongoing compression garments to keep that size down. So compression is a core therapy for lymphedema. Skincare is really important because remember, the lymphatic system is keeping the skin healthy by removing whatever is harmful that's coming into the skin. So when the lymphatic system doesn't work properly, we get a build-up of bacteria and things in the skin, and that can really affect the quality of the skin. So to use good moisturizers and keep the skin in good condition, make sure that we don't have too many small injuries and attend to small cuts and wounds quickly. That helps to reduce the risk of infection. And then exercise is really important because the lymph system, even in a normal healthy lymph system, it really can't move that fluid along by itself. Most people don't realize this about the veins as well. It's actually these skeletal muscle pumps. When we're just walking around doing our daily activity, the compression forces that the skeletal muscle pumps apply to all of these vessels really help the fluid to be returned back to the heart. So by doing the right kind of exercise, we also really help to keep the lymph flowing. So manual lymph drainage, compression, skincare and exercise are the 4 core components of lymphatic therapy, and we must be doing all 4 of those. We can also add some other adjunct therapies. We have things like lymph taping therapies, so we use elastic taping. We can use lasers to help some of the symptoms. There's a few other different kind of adjunct therapies that we can use, but those are not enough on their own. You have to be doing the 4 core therapies of lymphatic stimulation, compression, exercise, skincare.